This is Scott Becker with a special combined episode of the Becker's Healthcare and the Becker Private Equity Podcast. We're thrilled today to be joined by a founder in one of the most interesting areas of business that's out there today. We're joined today by Matt Brockmeier. Matt, why don't you take a moment and tell us a little bit about what you do and how you got started in it, and maybe also where you're living currently.
Okay, thanks, Scott. I'm glad to be here. So I began my career as a healthcare attorney, pretty standard payer contracting, healthcare hospital systems, reimbursement, that type of thing. In Chicago, graduated from DePaul Law School, moved to DC a few years after that, did some management consulting, policy work in academia. And then when Colorado legalized adult use cannabis around 2014, I moved to Denver to get involved in that area. And then during the pandemic, got interested in some laws that were being written in Colorado by some folks that I used to work with. We passed a ballot initiative in 2022 called the Natural Medicine Health Act. And what that did was simultaneously changed our criminal laws in Colorado to allow personal use of some natural medicines, namely psilocybin mushrooms and some mescaline-containing cacti. But also, we established a regulated model for adults to access psilocybin, which has shown tremendous promise and potential for treating a number of mental health conditions and disorders, including but definitely not limited to PTSD, anxiety, alcohol use disorder, substance use disorder. And so I had the chance to participate in the rulemaking process after the law was passed. And then I was approached by a group of entrepreneurs who initially just wanted to hire me to explain, the rules around this new industry that we created. But then they asked me to join the team, and I've been, I've gotten that offer a few times in my career, but this seemed like the right opportunity. So join the team, and the company is called Antithesis. So we're a vertically integrated natural medicine business. We're going to receive licenses from the state of Colorado to cultivate mushrooms, extract the active compounds, put them into products which are permitted under the state law, and then administer them via a licensed facilitator, kind of a therapist in these healing centers. So Entheogen is going to be the first vertically integrated natural medicine business, as far as we're aware, in the country.
That's amazing. Simply amazing. There's somebody we interviewed years ago who was a venture fund investing in these types of businesses. I think their name was Palo Santo. Is that the name of that? You've seen them? Some guys. They're from Chicago. We're familiar and stuff like that. What a fascinating business. And talk about, and what a fascinating business. Now, let me ask you a question. We have friends now, that recreational do what they call microdosing. Tell us about that trend.
Sure. So microdosing is a concept that basically you take a subperceptual dose. That's the key word there. Subperceptual dose of it could be any substance, but typically it's mushrooms. People microdose LSD also, but that's a whole other category. And so you don't actually feel the effects that you would under a larger dose. So it's typically around like 100 milligrams of dried fruiting body. That's not 100 milligrams of psilocybin. That would be a different experience for sure. And what it does is these substances are neuroplastic. So it means they can help you effectively make new connections in your brain, and your new synapses connect. So you get the benefits of the neuroplasticity of psilocybin, but without the trip, basically.
Gotcha. And so what's the difference between mushrooms and LSD? Because some of us are just not like...
So they're very similar. They're both serotonergic compounds, which means that their chemical structure is similar to that of a neurotransmitter called serotonin, which we all produce. And that's why these things work, is it's like a key and a lock that, it's like fits in the receptor site. So they have different affinities for different serotonin receptors, and that results in a different subjective experience. LSD has a stronger affinity, so it lasts longer. It usually lasts like 8 or 10 hours or longer if you take more. So, the experience is different. The molecules are a similar shape, and that's why they both fit into the serotonin receptor.
Take me through. Give me a second on the difference between serotonin and dopamine. Because we always talk about dopamine fixes. Serotonin, I think of as always sort of like longer lasting happiness. How do you think about serotonin versus?
Yeah. So some of these molecules are both serotonergic and dopaminergic, but in different ratios, I guess. But yeah, serotonin is typically referred to as like the happiness neurotransmitter, and dopamine is like the excitement or the anticipation neurotransmitter. Other drugs are much more dopaminergic. Cocaine, for instance, is like releases a lot of dopamine.
Let me ask you a question, because you mentioned cocaine. The Wall Street Journal ran a story today, one of their top stories today, on this sort of tremendous growth of cocaine again in the country. Spiking use, spiking growth, something like that. Why is that you're seeing the spike in those kinds of things? Is there anything that you've thought on at all?
I'm not sure. I did mention that I live in Colombia, which unfortunately has a sordid history of the illicit drug trade. I don't really understand why people are, if they're in fact, if the use of these other substances is increasing. I'm not really sure, because there are no health benefits, as far as I'm aware, to cocaine. As opposed to, and it's highly addictive and ruins lives, and also linked to the destruction of the rainforest, because that's where the illicit production occurs. On the other hand, mushrooms, you can grow them in your closet, and they're good for you, and they're not addictive.
It's so funny. When I saw the cocaine article today, I was like, it brought me back to the 1980s, and I thought, like, oh my God, and I don't know people that are using cocaine today. I just don't know them. I don't see it. So I was kind of curious as to where that comes from. And there was a whole narrative in the journal article about, because this drug was cut off, so that drug is getting hot again. It was just, I thought it was just fascinating. No, but so you're in the sort of, I can never pronounce it.
Psilocybin,
natural medicine. Yep. Fascinating. Congratulations. And you guys are growing, and hopefully the first fully vertically integrated psilocybin.
Yeah, and it's not just that. So we're going to grow the mushrooms ourselves, extract the compounds, and put them into products. Several of my co-founders already have a functional mushroom company. They grow lion's mane, cordyceps, reishi, turkey tail, and it's called Myco Love Farms. They're based in Longmont, Colorado, which is also where our separate grow facility will be. And so they're already doing this with different mushrooms. So we're ready to just, as soon as we receive the licenses, which we're very close to getting, working very closely with the state's natural medicine division, a really talented, committed group of regulators that really understands that this is the will of the voters, and we passed this law because people need access to something that works. And the current mental health regime, where you're throwing SSRIs at everybody, and they don't work as well as we hoped, and there are definitely drawbacks to long-term use of SSRIs.
And there's more and more precision medicine that really shows that this doesn't work or that does work. And so basically, you could be on something for years, and then they're finally doing precision medicine testing, and they show that it has really no impact on it.
Exactly. And so on top of that, though, so we're already prepared to grow the mushrooms. We're already doing this with other types of mushrooms. And we're hoping to open multiple healing centers across the state, just because, everything takes place in these healing centers. It's a controlled, supervised environment.
So what you're going to
it's not a retail model.
It's like how Vegas was there for casinos. Denver and Colorado is going to become, very exciting. It was one of the early places for cannabis as well.
Yeah, one of the first states for cannabis, and now we're leading the way with natural medicine, drug policy reform. But on top of that, we're going to have a digital platform, an app that tracks things like sleep and exercise and diet, and ties that into your before, during, and after experience with psilocybin. So it really is
amazing.
And we have, because we're growing the mushrooms ourselves, we'll have access to the data about what types of mushrooms work for what types of people and what types of conditions. And we're going to get really granular with this in a way that's never been done before.
I'll ask you one more question. If I want to lose weight, is there a specific mushroom for that or not? That's not in the same category.
No, that's just yoga. Just do yoga. A lot of yoga.
That's good. Matt, I want to thank you for joining us today on the Becker Business, the Becker Private Equity Podcast. What a pleasure to visit with you.
Thanks, man.
Thank you so much, Matt.